Well, thank you, Mr. Chairman. And before I begin, I do want to note that I am still very deeply concerned about the administration's cruel and chaotic policies that have now caused thousands of children to be separated from their parents with no apparent plan for reunification. We had a positive step yesterday with the injunction ordering children to be quickly reunited with their parents. But no matter how this plays out in the courts, we need answers about how these kids are going to be cared for, when they're going to be reunited with their families, what the future holds for those in similar situations going forward, and more. It's just unacceptable. It's inexcusable, and we don't have answers to those very straightforward questions yet. So we are going to keep asking the administration, pushing them to give us and the separated families some clear answers. Now, we are here today to discuss how to reduce health care costs, which is something I hear constantly when I'm home in my state. I know other families across the country feel the same way, so I'm very interested today in what our witnesses have to say about this issue, and I want to thank all of you for coming and joining us today. There are far too many stories about patients caught off guard by health care bills higher than they expected and concerned that they won't be able to afford the care they need. Patients like Leanne Teedy from my home state of Washington, after getting treatment for breast cancer, which she checked to be sure insurance would cover, she was surprised to get a bill for nearly $800. Her hospital was in the network, her surgeon was in the network, the anesthesiologist wasn't, so her insurance stuck her with most of the bill. And her story is not unique. Patients in Washington State and across the country have also experienced this so-called balance billing after learning providers were not in their insurance network. And her story is only part of the problem. People aren't just concerned about the cost of a surprise bill from providers who are out of network. They are concerned about the skyrocketing price of drugs, and they are concerned about the cost of rising insurance premiums. These are challenges that impact families every single day, and they are challenges President Trump promised time and again to address on the campaign trail. Unfortunately, it's difficult to imagine what else President Trump could possibly be doing to make these challenges worse. Since day one, he's not only failed to rein in prescription drug prices, but has brought chaos and uncertainty and higher costs to health care in this country across the board. He tried again and again to jam Trump Care bill through Congress, and when he couldn't do that, he chose to create Trump Care by sabotaging patients' care in every way he could, including doing just about everything possible to gut protections for people with pre-existing conditions, slashing investments in helping people get care and shortening enrollment windows, making it easier for insurers to sell junk plans, championing tax cuts for massive corporations paid for by policies that his own former health secretary said would raise premiums, and more. All of this sabotage has translated, according to independent analysis, to higher costs for so many patients. And this hasn't just impacted the healthcare marketplaces that were created under the Affordable Care Act. President Trump's efforts to undermine protections for people with pre-existing conditions could leave millions of people who are currently uninsured without the ability to afford the care they need. And he has sabotaged innovative efforts at lowering costs across the healthcare system. Instead of supporting sensible programs to bundle payments that encourage providers to keep costs down and deliver the best results for patients, President Trump delayed those programs and ultimately canceled some of them. And he left an important laboratory for experimenting with new and affordable and high-quality models for delivering care, the Centers for Medicaid and Medicare Innovation, without a director for a full year. Undermining opportunities to discover new cost-lowering innovations not only jeopardizes bipartisan reforms to contain costs that we secured in 2015, but it also perpetuates the premium increases and financial burdens patients are now facing, thanks to the President's healthcare sabotage. And as I have said before, all of this is especially frustrating because it didn't have to be this way. I continue to be deeply disappointed that the Republican leaders refused to support the bipartisan agreement that this committee agreed on months ago, which would have lowered premiums for this year and next and helped stabilize markets. And I've said, Mr. Chairman, I am still at the table if and when Republicans are ready to resume those negotiations. Now, as I said, there are a number of ideas that could help bend the curve over the long term that we begin to explore in the Affordable Care Act. I mentioned a few earlier, and I'm similarly very interested in how accountable care organizations can reduce costs by rewarding providers for good patient outcomes rather than racking up charges. I'm also proud that Washington State has helped lead the way with innovative new programs like the Medicaid Transformation Demonstration, which is designed to better coordinate care and help keep patients healthy in the first place. I'm looking forward to discussing these and other targeted approaches to lowering costs, but at the same time, I want to be clear, we can't talk about higher health care costs in our country without acknowledging the elephant in the room, which is that President Trump has dramatically increased them. And that's what's desperately needed in the near term, for Republican leaders to set aside tired partisan fights over health care, allow us to work together on the kinds of policies we were all able to agree on just months ago that could have made a significant difference for families nationwide. Democrats have wanted to do this work for years. We got close this past year. I'm confident we can still succeed if we work across the aisle and put patients and families first. Thank you, Mr. Chairman.